Good morning. Today we are going to have a short presentation about the osteology of the skull. And the objective of this presentation is going to be to name the skull bones and to indicate whether they are single or paired. And also to speak about the unique structures of the skull, such as the fontanelles, the sutures, and the paranasal sinuses. So the bones of the skull are forming the bony framework of the head. And they form the cranial cavity, which encases the brain and its affiliatives, of course. And we also have the orbital cavity, nasal cavity, of course, the oral cavity, and the middle ear cavity. We have 22 bones forming the skull, and they are grouped into categories: cranial and facial bones. We have 8 cranial bones. They are the frontal, 2 parietal, 2 temporal, and 1 occipital bone, and the sphenoid with the ethmoid bone. The frontal bone forms the forehead and the roof of the orbits and the anterior part of the cranial floor. This is the supraorbital margin, supraorbital notch, and foramen. This is the glabella. And the frontal bone, of course, articulates with the zygomatic bone and nasal bone. This point is named the nasion. And posteriorly it articulates with the parietal bones here. The 2 parietal bones here, on the right and the left, they form most of the roof of the cranium and the upper side walls of the cranial cavity here and here. And posteriorly they articulate with the occipital bone. They are separate from each other by the sagittal suture. This is the temporal bone here. This is the squama and the mastoid process. The temporal bone forms the lower lateral part of the side walls of the cranial cavity and part of the floor too. This is the mastoid process. This is the styloid process, the external auditory meatus, and this is the zygomatic arch. Like this is a projection of the temporal bone, projects anteriorly to meet another projection of the zygomatic bone to form the zygomatic arch here. Of course, on both sides, it is separated from the temporal, from the parietal bone by the squamous suture here. This is the occipital bone. The occipital bone forms the lower posterior aspect of the cranial wall and the posterior basilar part of the cranial floor. This is the external occipital protuberance, the superior knuckle line and the inferior knuckle line. This is the crest of the occipital bone, condyles of the occipital bone. They are oval-shaped projections. They will be placed on the cervical vertebra number 1, which is the atlas, and form the atlanto-occipital joint, which enables you to nod your head like when you say yes. The sphenoid and the ethmoid are deep inside. This here is the greater wing of the sphenoid on the right and on the left. The sphenoid is named the keystone bone of the cranium because it articulates with all other bones in the cranium. Let's see the sphenoid from the superior view of internal aspect of the cranium. This is the sphenoid. The sphenoid is a butterfly-shaped bone. It is a single bone. It is having greater wings and lesser wings here and here. So these are the wings of the butterfly. This is the body of the butterfly, the sella torsica. This is the dorsum celli, the tuberculum celli here. This is the hypophyseal fossa, which contain the pituitary gland here. So anterior clinoids and posterior clinoids. And the ethmoid bone, we can see part of the ethmoid bone superiorly here. This is the crista galli of the ethmoid, and this is the cribriform plate. Cribriform means like the sieve. Of course, this is foramen cecum here. And the ethmoid bone also, we can see it in the medial aspect of the orbit here. Medial, it forms most of the medial wall of the orbit here and here. And also it forms the perpendicular plate, which is the superior part of the nasal septum here, and the superior nasal bony walls, inferior, superior and middle nasal conchae. These are the bones of the cranial The bones of the face, they are 14. They are two nasal bones. The two nasal bones, they form the bridge of the nose where your glasses will be placed when if you wear glasses. And they articulate with the maxillary bones here. And we have two lacrimal bones. The lacrimal bones, they are the smallest bones in the face, and they contain the lacrimal fossa, which contains the lacrimal sac, which drains tears into the nasal cavity. That's why when people cry, they got their nasal cavity wet. And we have the zygomatic bone. It is also paired right and left. The zygomatic bone, it is the cheekbones. It forms the prominences of the face, and it forms the part of the floor of the orbit and the lateral side of the orbit, lateral wall of the orbit. And there's a projection of the zygomatic bone projects posteriorly to meet the anterior projection of the temporal bone to form the zygomatic arch, as we mentioned when we explained the temporal bone here. We have two maxillae. The maxillary bone is the bone of the upper jaw. It forms most of the floor of the orbit here, and the anterior wall of the upper jaw, and of course the anterior three-quarters of the hard palate of the mouth here. The hard palate is the roof of the mouth here. This is the alveolar process of the maxillae. Alveolar process means that the sockets that contain the roots of the teeth in the maxilla, the upper jaw. And inside the nose, we still have here the inferior nasal concha here and here, right and left. Now, the inferior nasal concha is a separate bone, independent bone. It's not part of the ethmoid bone, like the middle and the superior nasal conchae. And the conchae, in general, they are like scroll-like projections inside the nasal cavity, and they aim to increase the internal surface area, which is covered by mucous membrane, which helps in filtering and warming the air and going into the nasal cavity to the lungs. We have also the two palatine bones here. These are the two palatine bones here, and they form the posterior 1/4 of the hard palate of the mouth. And this is the mandible. The mandible, if we look at the mandible laterally, we can see the mandibular condyle, mandibular notch, coronoid process, ramus, and the angle of the mandible, the body of the mandible, tubercle of the mandible here. This is the mandibular fossa. This is the articular tubercle here. And of course, this is the temporal fossa and infratemporal fossa here, and pterygopalatine fossa here. These are the bones of the skull, including cranial bones and facial bones. Now, these bones in the skull are connected together mostly by sutures. Sutures is a special type of immovable joints. We name them synarthroses. And the major sutures we have are the frontal suture that separates frontal bone from two parietal bones posteriorly. We have the sagittal suture here, and this point where the sagittal suture intersects with the coronal suture, we name it the bregma. And here we have the sagittal suture intersect with the lambdoid suture, which separates the two parietal bones from the occipital bone. We name this lambda because it looks like the Greek letter lambda. And here we name this the astrion, and this is the pterion. Now, the pterion suture here is like H-shaped suture, a capital letter H in English. It joins four bones altogether. We have here the frontal, sphenoidal, and temporal with parietal bones. This is of important clinical significance because when some people sometimes they hit their head in an accident or any other reason, and this could lead to middle meningeal artery to be injured and cause and lead to epidural hematoma. The paranasal sinuses, we have of course frontal sinuses and maxillary sinuses, ethmoid and sphenoid sinuses. These sinuses, all of them, they drain into the nasal cavity. They are cavities that lined with a mucous membrane, and this mucous membrane is secreting some fluid to help catch the particles inside from the air going into the lungs. So it is forming a filter, and it also warms the air going into the lungs. And of course it resonates the sounds also, like resonating chambers. It forms resonating chambers. The fontanelles of the skull. Now we don't have a baby skull here, but the fontanelles, we have the anterior fontanelle here. If you have a baby skull, it is a soft spot, like it is a pulsating spot here. This is anterior fontanelle, and it takes around 18 to 24 months to close up. And of course, this is the posterior fontanelle here between the two parietal bones and the occipital bone. Sometimes we have sutural bones in this lambda, in this lambdoid suture. And we have the anterolateral fontanelle. We might name it, we may name it sphenoidal fontanelle, and mastoidal fontanelle, or we can say posterolateral fontanelle. Of course, in both sides. This is the right side, and here is the left side, here and here. So we altogether have 6 fontanelles: anterior, posterior fontanelle, and anterolateral, posterolateral, or we can name them sphenoidal and mastoidal fontanelles. And of course, these fontanelles, they allow the brain to to grow completely, and most of them, they close around 1-2 months or 3 months after birth. We don't really feel them most of the time, but of course we always see this pulsating spot, which is the anterior fontanelle, because it takes longer time to close up, and it is very clear, especially when the babies have less hair on their head. I think that's all for today. Okay, we have also a lot of foramina in the skull. These foramina, we are not going to be able to explain all of them right now, but we are going to speak about the major or principal foramina. The largest foramen in the skull is the foramen magnum here. The contents passed through it is the medulla oblongata. The medulla oblongata, of course, it is the lower part of the brain with the vertebral arteries and spinal arteries and veins. And of course, this is the carotid artery here, where I insert the pen here. This is the carotid foramen, where the carotid artery passes. The posterior to it is the jugular foramen, where the internal jugular vein exits the skull, and with some nerves like 9th, 10th, and 11th cranial nerves. This is the foramen lacerum. It is usually closed up with the cartilage, and this is the foramen ovale, and this is foramen spinosum here. Here we have these are the choani, the posterior nasal and nostril. Okay, this is the lateral pterygoid, and this is the medial pterygoid, and this is the hamulus here. And foramina here, if we see the orbit, we have this is at the upper medial corner here. We have the optic foramen, which allows the passage of the optic nerve and the ophthalmic artery. And we have here the superior orbital fissure, which is located in between the wings of the sphenoid. And this is the inferior orbital fissure, which is located between the greater wing and the maxillary bone here. And these fissures, of course, they allow the passage of cranial nerves and related blood vessels. This is the infraorbital foramen, supraorbital foramen, the mental foramen, and here we have also the mandibular foramen, and all of them, of course, they allow the passage of nerves and related blood vessels. And I think that's all for today. I hope this was helpful, and of course we will go through much more details in upcoming video, inshallah. Thank you.